Hello, welcome to the Healthy Alternatives podcast. I am Dr. Christine Sauer with DocChristine.com. Today's show is a recording of my radio show of the same name. Enjoy! Good afternoon, this is Dr. Christine Sauer, your host of the show Healthy Alternatives here on 97.5 CIOE-FM with live stream on communityradio.ca every Thursday at 12 noon Atlantic Standard Time. Thanks for tuning in today. In this show, I will talk mostly with guests about all aspects of health, healthcare and wellness, from conventional to alternative and everything in between. My mission for this radio show is to help change people's lives for the better by informing them about different options to get and stay healthy and well so they can choose for themselves which option might work in their case. And if you feel you are stuck in a dark place, I want to tell you there is a light at the end of the tunnel. Today I'm extremely pleased to be with my friend Dr. Andrew Kleinknecht. I pronounce it the German way. A chiropractor, speaker, and wellness expert. He works with private clients as well as corporate health. And he's not German, also his family must come from there because his name is German. So tell me a little bit about your story.
Well, thanks for that, Dr. Christine. You say my name much better than I do. But I'm from Ontario. Met my wife, who's from Prince Edward Island at University at Mount Allison. I'm a second-generation chiropractor and just always been passionate about healthcare, about helping people. I'm one of those rare people, I guess, who knew in grade 9, 10 that I was going to be in healthcare and I was going to serve people. And with my father's example, I guess I jumped on board.
That is wonderful. That is so wonderful. And you're still a young man, so you still have a lot of long life in front of you. And you told me in the break you always ask your clients one question. What's that?
I love to ask people to get them to think. I'll say to them, who wants to live to be 100? And quite commonly, you get the range of answers from no way, not if I feel like this, to maybe, to depends what I feel like, and all of the above. And my response to them is, what if you don't have a choice? Because unless you're into throwing yourself under a bus, and I say that tongue in cheek, we all know our population is aging. And especially here in Nova Scotia, we have, frankly, one of the oldest populations per capita in Canada. Mm-hmm. So it's a great conversation to have with people because people, I feel, we all need to understand better that we have to take care of ourselves. We have to prepare for our longevity. A lot of people are blindsided, and frankly, not to be crass, but I feel that's why nursing homes are such good business nowadays, which is a shame.
Yes, I couldn't agree more. I love the way you said that people have to prepare for their longevity. That's what I do as a health planner. I help make a plan and tell them, yes, you can live old and stay healthy, but you have to do something for it. Yeah. And it can't just be that you eat a salad once a week or you take a supplement once a day that you don't even know if it works or not. Yeah. It has to be a concerted effort.
For sure.
And I love that you do that. I know that you speak, and that's wonderful. We both do. And that is so wonderful to tell the people, prepare for your longevity. I love that.
Yeah, I mean, I think two things I see in my practice that build around this are people's notion of healthcare. If I can tell a short story.
Sure.
My immigrants, Christine, came from Germany, as you know.
Yes.
And so my mom's side, they came over years ago after the war, like a lot of great immigrants to this country. And, immediate family, my mom and her identical twin. And their notion of healthcare was really out of necessity, but it really became the trend in those days for people of this notion that if it ain't broke, don't fix it. And it's incredible as a chiropractor working on people's spine, nervous system, their brain function, which is all part and parcel of that. Mm-hmm. It's just detrimental. It's not how you live a healthy, active life. I mean, it keeps us busy, I guess, Christine, and it keeps us very busy in our clinic. But that's that's a tough way to go about it.
Yeah, and that's the same. We both say basically the same things, which is the truth. And it's important that people hear it. You have to plan for your health. And I wonder, there's financial planners, there's wedding planners, there's all kinds of planners. You even can plan your funeral. Who plans for their health?
Yeah.
And I always believe, like you said, if it ain't fixed and broken, that's just not true.
Yeah.
We can plan for our longevity. Yes, there's instances where health happens to us. When we fall down the steps, break the arm, well, it's an accident. We can't prepare for that too much.
Yeah.
Except for holding on to the railing, maybe. But our long-term health, we have influence on that. And I love chiropractic care, not just for the adjustments, which is part of it, but also for the importance that you emphasize healthy living.
Yeah. I mean, we always feel we're part of the healthcare team. Wasn't always that way. I joke with people. I grew up in an era where it wasn't cool to say your dad's a chiropractor. I mean, I remember literally coming home from school and asking my mom, "Is Dad killing people?"
Yeah.
You know, because the stories, your dad's a quack and this and that. And I don't say that to look for sympathy. I'm just saying every disciplined medical doctors. My brother-in-law's a medical doctor. My sister's an occupational therapist. People like yourself, naturopaths. Everybody has a role to play.
Yes.
And as chiropractors, our unique play, at least the way I see it, is the spine and nervous system. And people don't realize you literally do live your life through your nervous system.
Exactly. What can you do when your nervous system don't work? That's exactly what people are afraid of nowadays. And they take it for some kind of a fate that when they get older, oh yeah, I'll go to a nursing home, I'll get demented just like everybody. That's not normal. Mm-hmm. And when you look years back, yes, we live longer now than we used to on average. But years ago, once you survived the dangerous childhood years where you died from infections, once you lived to a ripe old age, you could expect to stay well and look after yourself. And not for nothing were they revered as elders, wise men. Now, where's those wise old people nowadays? There are a few, but I think most of us could be there if we took care of ourselves.
Absolutely.
So tell me a little bit what you, as a modern chiropractor, exactly do when somebody comes to you. Most people probably come with a pain-related problem and say, I just need an adjustment, but don't do my spine because it can cause a stroke. Yes. No, it won't, of course.
Yeah. Well, here's the thing. I guess, Christine, most people think of a chiropractor, as you know, they'll call us when there's a crisis, and that's typically, you know, my low back or crackerjack. Yeah, sciatic nerve pain is a common thing, or numbness or tingling from their neck down their arms or finger. Or headaches. Those are the real. We're excellent at that. That's really what we've become famous for, I suppose, nowadays. And
it is extremely important. I can say that from my own experience, without a chiropractor, my back wouldn't be as good as it is now.
Well, thanks for that. Yeah, I mean, it's another conversation around the whole opioid addiction issues going on and back problems. And we as a profession, we're pleased to say that we've actually been asked to that table too, because people are realizing to start on OxyContin or those types of derivatives the first time you have a back problem, it's disastrous. Health Canada knows it, and they need help too. So I guess, like I say, that's the first reason why people would typically see a chiropractor, and we kind of educate people from there after that about what's usually going on behind it, which I can chat about if you like. But
yeah, sure. And there's a lot going behind it, because if our messaging don't work, the whole body doesn't work together. The nervous system is one of the major parts of the body that needs to function. It's the same as an electrical circuit in your house.
That's right. Yeah. Great analogy. And, like I said earlier, you live your life through your nervous system. If you think of it this way, you don't tell your heart to beat or your lungs to breathe 365, 24/7, or your bowels to work, or your eyes to blink. all those things are controlled and coordinated, as we know, by the brain and the spinal cord. So that brain and spinal cord really gets irritated when the vertebrae go a wee bit out of alignment. And I say wee bit because people need to understand this isn't some drastic thing, as you know, Christine. This is just a slight malalignment. And that's what chiropractors are trained to detect, if you will, kind of like a dentist will notice a cavity in your tooth. A chiropractor is trained to detect when the vertebrae go a little bit out of alignment, and then we use our hands or an instrument in our office to what we call adjust the vertebrae back in line, which allows the brain and the body to communicate through the spinal cord better, because that being out of alignment definitely will interfere with the nerve messages, which to you and me can mean pain, or it could be a headache, or it can mean digestive issues, or colic, or those kinds of things that are related to nerve function, but people don't often realize it.
I think what many people don't realize, and I wasn't clear about that either before I came to Canada, that those little maladjustments can happen even if you have no problems so far. And they get you started on the road downhill. So that's why many chiropractors, probably yourself, say children should have prophylaxis visits.
Yes.
Because I know it for myself, and I sit at my computer, I'm right-handed. So a few vertebrae get out of adjustment.
Yeah.
And even if I don't have pain, usually there's something not right when I go to my chiropractor. So I think that's really part of what you do to prevent it from really getting so bad that you have the pain.
That's right. That's right. Our practice, like I said, if you want to think of it like dentistry for the spine, in our office now, chiropractors will focus on different issues. Some are workers' compensation driven or sports driven. Our practice tends to be family based. We have extra training in children and pediatrics, pregnancy, that kind of stuff. But the birth process can be extremely difficult, and pre-verbal babies can't tell mom where they hurt. They scream and cry. Hence the colic thing if it's a birth issue. But most of the kids we see, they're trying to get a good start in life and grow up with a spine that's healthy and strong, and frankly avoid the stuff that quote unquote mom and dad had.
That is so true. That is so true. And I remember when my son was a baby, he was colicky, and it was very hard to quiet him down. And at this point, I was more a conventional doctor than a naturopath at this point. My husband was a family doctor, so, we just gave him some carminativum, some tinctures. It didn't help much. We spent a lot of sleepless nights.
Yeah.
And the sad thing in Germany is that chiropractors are not very common there. And many physicians pretend to be chiropractors without having the extensive education that you guys here have. And I know my ex-husband, he took the course for it, so I know what it is. And it can be okay, but it's just a cracking thing.
Yeah.
And it's just not the same.
Yeah.
And when you experience a true chiropractor, it's night and day. Yeah. Thanks for that. I appreciate that. Like I say, everybody has their own specialty and needs to be that way. It's why we're licensed and we go to school for probably about 7 years nowadays in Canada. A degree and 4 years chiropractic education, not that dissimilar to a family physician with obviously a different focus. But that's what we're trained to do. It's very safe. It's very effective. Like I say, I work on children 3 years old. I work on people 99 that if you breathe the wrong way, you think they'd fracture a rib. Their bones are that fragile. And they both come in and leave with a smile on their face. So that's how you know it's not hurting anybody. And that is a wonderful way to end our first half of today's broadcast here on 97.5 CIOE FM Community Radio. Please tune in after the commercial break for more about chiropractor with Dr. Andrew Kleinknecht. Thank you. and welcome back to Healthy Alternatives here on 97.5 CIOE-FM or on the web at communityradio.ca. I'm your host, Dr. Christine Sauer, and today I am happy to talk with Dr. Andrew Kleinknecht. In the first half, we talked about the journals of chiropractor and that he really contributes for people to prepare for longevity, which is a wonderful concept. And we talked a little bit in the break about that it is important that people make an informed choice about their health. And I know it's a little bit of a political issue that in our society, many costs of healthcare are covered and necessary. I won't say anything about conventional medicine. It's a necessary part of medicine, and they do an awesome job with acute illnesses, infections, when you break a bone, when you have appendicitis. It's all illnesses you died from in earlier years. But when it comes to long-term health, I think they're missing some factors sometimes, and that may be historically, and many doctors try to get there, and sometimes it's supported, sometimes it's not. And I know the doctors are all willing and very good people, but I really feel there's some what we call complementary practitioners or therapies out there like yourself.
And yourself.
Thank you. That are absolute necessary. And I think it would save the system a lot of money if they paid for at least some of it. I remember I was in a pain clinic for 10 years. I didn't see a chiropractor. They didn't have one. In the pain clinic, for heaven's sake. And I believe that my twice yearly injections of steroids, which is kind of a day surgery thing, big thing, is probably more expensive than for the system was, I don't need it no more, than what I pay now to my chiropractor.
Well, yeah, economics aside, for sure.
Yeah.
There's just so many layers to that one. I mean, I did a presentation with an emergency room physician a few years ago, which I don't think it's appropriate to say his name here, but we both spoke on the issue. As I was saying, I look through the lens of healthcare as what do we do to be healthier?
Yes.
What do we do to maximize human potential?
Right.
Versus I'm broke, I need something. Pathogenesis, the word means to break things down, look at the cell biology behind sickness and disease, and then prescribe something, which is effective and necessary at times, as you just said. What I like to focus, and I think what you focus on too, is a word called salutogenesis.
I like that.
Salutogenesis. Where does health come from? How do we get healthier? How do I get the most out of my life? And if you want, I can expand a little bit. But I mean, we see the hierarchy of healthcare, we'll call it, viewed through this way. At the very top of the pyramid, if you will, you're going to talk about self-care. Yeah. Which you can do for yourself that costs no money. And you and I can, exercise, turn off the TV, eat differently. That's self-care.
Yes.
And if we can encourage our patients and people in society to do a lot more of that to themselves.
And you can do it in small, easy lifestyle changes. They can be fun too. It doesn't have to be a chore, and you don't have to be perfect to achieve a real change.
That's right.
I love that.
Yes.
So what's the next step?
Next step is healthcare. They're seeing Dr. Christine. They're seeing Dr. Andrew. They can't do it to themselves. So they don't want to adjust their self. They don't want to prescribe their own supplements and nutrition. They need a professional person for healthcare.
For guidance.
Absolutely. Or they're seeing their medical doctor for well checks, or they're seeing their dentist or their optometrist. But if they've done a lot of healthcare, as I think you would agree, then they don't need so much
sick care.
I'm sorry. Yes, you're right. If they've done a lot of self-care, they don't need so much health care. And at the very bottom is where people would enter the system, which is sick care.
Sick care, exactly.
Dr.
Maintenance
Christine
of illness.
Says. Yes.
Good word. I love that pyramid. It's so true.
At the very bottom, we would like to turn it on its end and enter the system with self-care. And then, as you say, sometimes things happen, accidents, but by odds, if you go through it that way, you don't turn into the sick care at the very bottom, which is really the modern system. I feel, it's crisis care oriented, it's sick care oriented. It's not health care.
I agree. And what really gets propagated often is, and I see it on TV, they do research for a certain topic like dementia. And they only search for new medications. Sadly, that's where the money is. But there's so many other options to go with less money for better results that they don't mention. They just look for the easy pill. It doesn't work.
Yeah, doctor, you know this. You work in that world more than I do with dementia and brain degenerative brain issues. I mean, it is frightening, and the emphasis needs to be more. I think you'd agree on lifestyle prevention. It's not sexy, doesn't get a lot of attention, but as I did this presentation, alluding back to this medical physician, this Emerge doc, he's like, you guys don't want to see me the first time you can't move on my emergency room floor.
Exactly.
Or you just had your first heart attack and now you're going to change your lifestyle. It's great. Let's do it. But go further upstream, and your patients benefit from that.
Yes, and so do yours.
Yes.
And that is a wonderful way to look at it, because I really think every person has, especially nowadays, we have a lot of freedom. We have the freedom to choose whether we invest our money to buy the newest version of the iPhone, or whether we go to you for a year or buy one of my plans.
Yeah.
And sadly, many people still choose the iPhone.
Yeah.
For whatever reasons, for immediate pleasure and play video games and all that nonsense, which doesn't get them healthier.
Yeah, it's hard to watch, isn't it? And I know sometimes we talk about it in our clinic, my wife and I, all the time of I guess, giving patients a safe place to fail. Because sometimes people have to go through the crisis 1, 2, 3 times before they go, you know what, doc, you're right. I'm a fisherman. I'm going to keep fishing, and I'm going to come see you once a month or whatever so that I can continue this instead of wrecking yourself, waiting for the next crisis and the next crisis. And as you know, every time there's a crisis, no matter the type, it gets harder and harder to fix it as well.
That's right. Yeah. It does. And so what's your ideal patient that you love to see? And of course, somebody that wants to be healthy, and there are some people that don't because they get benefit from staying sick.
You said it. That's a whole other discussion.
I won't say it's not necessary to have those benefits for some people, but we'll leave it at here. So what's your ideal patient, client?
Well, I guess our ideal patient, if you want, is a family. Mom and dad, the partners come in and they want to be well. Oftentimes they'll start with a back problem or a headache or sciatica, but understand that my kids learn better. They're more focused. They get less colds. They are more active when they get regular adjustments. So these are trends we see for real in our office after 20 plus years. So it starts off, like I said, fairly routine, mechanical, pain-based, but then people understand the whole wellness concept and I want to be as well as I can and maximize my potential on planet Earth, if you want, while I'm still here. And people that are interested in that's who we want to see, I guess, if that's helpful.
Yes, definitely, because that's people that really want to be healthy. They want to be 100 years old, but if I get 100, I don't want to be in a nursing home demented. That's not my idea of a life.
That's right. Yeah. I mean,
we do whatever we can to prevent it, and we try to get other people to see the benefits. Yeah. But as you say and I say, we can't force people to our opinion. We can put the horse to the water, but we can't make it drink, as you say, and that's really true. And I really want to encourage everybody that listens to that, think about it and think what you want to do when you get older.
Yeah. Sure.
What do you want your fate to be? And it's not inevitable.
Yeah.
Go to somebody that can give you a plan or can help you get your nervous system straightened out, help you with your nutrition changes.
Yeah, we work with people like Dr. Christine, like you, all the time, as you know.
Yes.
And it's just there's many facets to being well.
Yes.
We tend to focus on the spine nervous system in our office, but we do a lot of nutrition work and refer people like yourself because
it is
it's so part
important. I always say healthcare is a team effort, and one provider can't do it all. It just doesn't work. Yes, your family physician can give you a pill for your headache. But what about seeing Andrew for the cause?
Or Christine for a nutrient
thing. Or seeing me for a supplement plan to avoid it for the future, because maybe it was not enough magnesium. But as I always say, nutrients, and you know that, is an orchestra. And if people take one supplement, it's like you want to go to a symphony and you only hear the first violinist. That's not a good symphony. You need an orchestra of nutrients in your body.
Yeah.
And so that's why many studies say that certain nutrients don't have any benefits. Of course not, when you take them by themselves.
Yes. Yeah.
That's the same when you go to the chiropractor with a serious back problem. He cracks you and make it better for a week or two, if you're lucky, and then it comes back. Of course it does.
Yeah.
Because your body got used to the malalignment.
Yeah.
So it is a process, and it's hard to...
Yes, that's right. And the longer you've had an issue, that's the beauty of seeing children. The longer it takes to correct it.
Right.
I would say the average person we see is probably 40, 50 years old. More and more seniors all the time looking to be active and stay active. But the whole notion, once you go to a chiropractor, do you have to go forever? We kind of say, well, why wouldn't you? But nobody's putting a gun to your head saying, take care of yourself preventatively, think to the future. That's the whole point behind going to a chiropractor regularly, is just to be preventative minded.
And I love that. And that is a wonderful close to today's show. Thank you so much, Andrew, for coming today.
Thanks for having me.
And please don't hesitate to contact me with any questions, thoughts, comment, or suggestion. Or if you'd like to contact Dr. Andrew, he has an office in St. Margaret's Bay, and my email here is Christine, CHRISTNIE @communityradio.ca, and I'm always grateful for any feedback, and I'd be happy to connect you with Andrew, Dr. Kleinknecht. I also want to extend a special thank you to today's producer, Jim Francis, and his lovely assistant, Hannah. And thank you all for listening to Healthy Alternatives. I'm your host, Dr. Christine Sauer. Tune in next Thursday at noon on 97.5 CIOE-FM Community Radio with live stream on communityradio.ca for the next episode. Goodbye and have a great day.